electrocardiogram. You guys already know it can be called ACG or
EKG.
AKG. What's the other one?
ECG.
ECG, which are the same thing. So the supply that I have is my patches here. I brought 2 just in case that my patient, they are not sticking on really well. I'm gonna have back out and leaving the room, coming back and annoying my patient, so I have it. You're gonna bring alcohol wipes to clean it in case they have any lotion on their body, if they're like sweating, anything like that. But before I clean them, I'm gonna ask them, do you have any allergies?
No.
All right, so Mr. Ian is here because he's having some chest pain, and my provider said you can go ahead and do an EKG. First thing I'm gonna do is getting my gloves on, and I'm gonna ask my patient, is it okay for me to touch you?
Yes.
Awesome. So electrocardiogram, what we're gonna do, we gotta put 10 patches on you. 1 goes on this shoulder, 1 goes on the other one, 6 goes on your chest, and then the underarm, and 2 of them gonna go on your legs, okay?
Okay.
So I'm gonna go ahead and open this. If your patient has hairy, there are different methods based on your clinic. A lot of places do not want you to shave the patients because you can hurt them, okay? So sorry, Mr. Ian, this is gonna be a little bit painful. So what I do, I put one of these on my patient. I'm gonna put one of these on my patient and kind of like pull it gently so I can get some of those air out. A lot of time people like start like trying to move as much as they can. You can try that, but it's not gonna always work, okay? So if you wanna come closer, Anna Mary will not get you guys. Just focus on Ian's chest. So I'm gonna put this where I wanna go, but before I do that, start from the clavicle, right? So this is right side and this is his left side. And my patient heart is on the left side, right? So I'm gonna start from the clavicle, feel for the intercostal spaces. So V1 goes to? The fourth intercostal space. Different methods, remember, on the opposite side of the heart. Different methods. People do, starting from the clavicle, grab 2 fingers and measure it this way. Do not let go of this hand. Bring another 2 fingers. 3rd, 4th. Not always accurate. If you want to try that method, go for it. But if your patient is long and their chest is longer, you might miss it, right? So it's not always the best method. Always try to feel that intercostal space in between. Remember the other one I was telling you, the sternum? So like him, I can feel his sternum right here. So you go in the sternum and I can feel right here that I can push down. And if I push really hard and right here, he's gonna say hurt, he's gonna say out because this is his ribs right here. So this is going to be my first intercostal space, and this is the rib. This is my second, and this is the rib. This is my 3rd, and this is my 4th right here. So this is going to be my 4th intercostal space, the second method. First method was this. Second method is like when you're feeling between the intercostal space as you're going on your sides of sternum. Okay. Another method that is my favorite is I grab my 2 fingers and I start from the clavicle because that's where your first rib is, right? That is kind of hiding under the clavicle. So I feel for this space. As I'm pushing down, I'm like, okay, I feel, and you guys can see I'm not coming on the breast tissue. I'm going on the sides, right next to the sternum, right? So I'm pressing down in here. I'm like, okay, there's a little bit space. And right under my fingers, there's the rib because I can't push down on it. If they're laying down, it's a lot more better for you to feel it. And as I keep going down, that's my 2nd, and that's the rib, and this is my 3rd, and this is my 4th right here. So since the first one, I'm not as worried that I'm gonna mess up anything, so I'm just gonna put gently down in here, give it a little bit wrap. Sorry, Ian.
Oh,
1,
no,
2, 3.
it's okay.
It's probably like got 1. See, 1 out. It's not the best, but I'm gonna try 1 more. See if I can get a little bit more. And no, not really, but it's okay. I'm not gonna hurt Ian. He's already being sweet, wanting to aim for us. So let's just pretend that in here we were able to cut some of them or shave if you're allowed to use razors in your clinic. If not, trim it. There is a method in your clinics that you can use it. Right here, I'm just gonna try my best to get the hair out of the way. See? Okay. Now I'm gonna get my alcohol wipe. I'm gonna make sure. Even like ask your patient if they use any lotion or anything, or if they were exercising or sweating, go ahead and clean it. That doesn't hurt. Even if they say, nope, I just took a shower. Sure, it doesn't ever hurt to clean, right? So right side, left side. Since I'm gonna go for the rest of my stuff on the left side, so I'm gonna go around. Okay, I'm gonna clean as much as can. Cleaning never hurts. In here, if you want to fan it, that's okay. So fanning in here is okay because we're not going to inject, right? But if we would inject, we don't fan. Okay, so when we get our patches on the chest, it's always going to be this alligator part. These guys are like alligator parts that I call it. So they're going to come right on the edges here. So this is going to be sitting right here. So V1, right side. I would just started on the V2. This is my V1 right here. It's not staying really well, Ian.
Sorry I didn't shave first.
How could you? Didn't you know we're gonna need you today? Okay, there we go, much better. So V1 and V2. V3 I'm gonna skip. I'm gonna go to V4. V4 is on our 5th intercostal, mid clavicle. So this is the clavicle right here. Mid clavicle is gonna go right here, and that's going to be my V4. V1, V2, V3 is going to be in between. Okay, so this is my V2 and this is my V4. My V3 is gonna go right in the middle of this guys. And now where's my V5? Good job. It's still on the 5th intercostal, right? Still on the 5th intercostal, but it's going to be on interior axillary line, which is right here. If this is my 5th intercostal and this is my axillary line, but I want it to be on the interior axillary line, right? And then my V6 is going to be on mid axillary line, so like right under the armpit. Do not have your patients, like if they're wearing a gown, people have like, okay, I'm gonna go based on this gown line. Don't go on that. Always look at the arm and be like, okay, right there under the axillary line. So these are my chest slits, and now I'm gonna go to on the deltoids. So that's my right deltoid. Again, I'm gonna clean it. I know I forgot cleaning, but I cleaned it. You saw me cleaning. And second one, is it okay if I roll your pencil a little bit up?
Yeah.
Awesome. And then we're gonna go, same thing in here. If there's hair, try your best to get it out of the way. If you cannot get it out of the way, go with the best you can. This one is facing up, see? Because when I put my cords on it, it's going to be facing up and I don't wanna get all tangled up. So I'm gonna be putting it right here. That was me trying my best to get it out of the way. Okay. With your EKG machines, they might be attached to your computers, or or you might have to bring it in the room with you. So you're always gonna have something like this. You don't want this to be laying down, being dangling down, because it might pull the cords with it, right? So I always ask my patient if it's okay for them to just rest this on your abdomen or on the side or somewhere that it's not gonna fall. Is it okay if I put you on your tummy?
Absolutely.
Or on your legs? Okay. So once I get that, I'm not gonna smack my patient on his face, especially this nice patient who's willing to volunteer for us. I'm gonna start from this two right here. LA is for left arm. LL is left leg. Okay, so left leg facing up. See how it's easy? And you just push this down. And then LA is left. V1 for intercostal, V2, V3, V4, V5.
You miss a leg.
We're missing an arm as well. V5. And then this over here. Beautiful. Okay. Do you want to touch right arm for me? Beautiful. Yeah, attach the left leg.
For where? Sorry if I'm touching you.
It's okay. I consented to the procedure.
Okay, so from here, you're gonna see what kind of machine you have, and you're gonna get started, and it's going to be reading the screen here for you. Remember, some of them will be showing like abnormal. it doesn't mean that the patient is having something going on. It might be abnormal with something with the cord. And as I said, there might be some phone, Apple Watches, necklaces. There's something around there. So make sure you see, watch it for a second. Don't just hit print or send it to your provider, and confirm that your cords or your pads are all pretty good. Then go ahead and print it out. And I never unattach these until I go check with my provider. So like right here, I run a set, I print it out, I'm gonna go talk to my provider, but I'm gonna give my patient, cover my patient up, and I'm gonna let them know that I'm just gonna go ahead and step out, talk to the provider, and I'll be back if they want, just in case they want another one, right?
Yeah.
And if they don't want it, then I'll come back and unhook my patient. Okay? Bye. Go ahead and turn it on, please.